we understand a wound is any physiological injury that compromises that normal integrity of the skin.
Yes.
So despite how small the compromise is, we'll call that one a wound. So a wound arising from an accident, let's say with a motorbike or whichever kind of an accident, that's a traumatic wound. It will immediately, it's an acute wound, but falling under trauma. We also call them degloving injury, depending on the nature of fall. Like ameanguka, a large area of skin has been avulsed from the skin, so we call it degloving injury. It's a traumatic wound. Most of the times, these wounds normally tend to bleed a lot because there is trauma on blood vessels. And the immediate management will be one, to stop the bleeding, and two, to prevent entry of bacteria and maybe those non-viable particles on the surface getting into the wound. So immediate care, okay, there's the body's response, we call it the hemostatic phase, to try and stop that bleeding. But at times, if the body is not capable of doing that on its own, then secondarily we'll need to apply pressure on this bleeding portion so that we can be able to contain bleeding or help stop the bleeding.
Okay.
That's the immediate care.
The immediate care.
Yes.
Now, talk about more on the classification of wounds.
We classify wounds in around 4 segments. One, we have the trauma, or traumatic kind of wounds, and these ones also have got subcategories. Now, the likes of cuts, be it surgical or non-surgical, you have the elements of now laceration, friction, animal bites, gunshot wounds, all those ones, because it's traumatic, there's something which penetrates or forces the tissues to rupture the skin to open up. So we call it that is traumatic kind of wounds. Then under that one we have, okay, now that's the first category. The second category classification, you have burns. Burns, you may have burns from hot liquids, hot gases, hot contacts. We have chemical burns, you have radiation burns, burns from friction. You've had like those athletes, they fall on, they have like a friction burn, or grass burn, commonly called grass burns. Even negative thermal effects, for instance, you're subjected to extreme low temperatures for a prolonged period of time. Also, that one is a kind of burn. Then the other category is normally caused by a predisposing comorbid. For instance, an underlying condition. You've heard of those under, let's say, endocrine conditions like diabetic foot ulcers. There are those also under a category called this lower leg ulcers because of vascular conditions like venous ulcers, arterial ulcers. Those ones also is a subcategory. Those are predisposing comorbids. And then the other category is normally from pressure, like you exert a lot of pressure. Commonly, people know them as pressure ulcers. In facilities, you'll hear people talking about the patient has a bed sore or something because of that prolonged period of time on a surface. So there's the bony prominence and the surface creating a lot of pressure in between, and we lose some tissues.
Yes. Yes. Now, I would also want to hear your views on wound sterility. What is wound sterility?
Wound sterility, now this one falls under what normally call infection prevention and management.
Okay.
You find that most times there is that normal flora, we call them normal bacteria on the skin. They don't cause any harm on a normal skin. But then it gets to a point, let's say if there's a break on the skin and they find entry into the body, that is when we get concerned, because at times the body is not capable of fighting them off. Yes. So when you're talking about wound sterility, this is creating an ideal environment, bacteria-free, or there is no entry of microorganisms into the wound. Yes. And that's everything we'll be talking about sterility. So it is a wide scope involving how you clean the wound, how you prepare the environment, the kind of material that you're putting on top, so that the entire goal is to prevent entry of bacteria into the wound, from whichever surfaces.
Yes.